Hello everyone and welcome to our monthly Strengthening Families Networking webinar. My name is Kaylin O'Connor from the Center for the Study of Social Policy, and I'm very excited today that our topic is using strengthening families to inform a collective impact approach. We will get started right away. Today I'll be giving some updates from the Center for the Study of Social Policy, and we'll have a very brief update from the National Alliance of Children's Trust and Prevention Funds, and then we'll get into our topic. Where we're joined by Blythe Butler and Sammy Berger from the First 2000 Days Network in Calgary. Here I am. I'll share a little bit about these webinars for anyone who's new. When you're in GoToWebinar, you can always either call in on the phone or use your computer, but you always want to make sure you're telling GoToWebinar which way you're doing that so you don't get audio problems. If you do call in by phone, use your audio PIN. That will allow us to unmute you if you want to speak. And if you do want to speak, you can raise your hand using the little button on your webinar panel, and that will let us know that you'd like to say something, and we can unmute you. You can also always type something into the questions box, and we will read it aloud if that's better for you, or we can even just respond in writing if it's a more technical question just for us running the webinar. We do these webinars every month on the second Thursday at this time, and it's an open invitation to anyone who's using the Protective Factors Framework or coordinating strengthening families efforts. We're always pleased to have people from the state, the community, the local level, and even the program level. If you feel the topic is relevant, feel free to join us anytime, and you can also always invite your colleagues if the topic is relevant to them. As I mentioned, we convene these along with, from my organization, CSSP, and then with our partners at the National Alliance of Children's Trust and Prevention Funds. We coordinate the topics and bring in guest speakers and always welcome your suggestions for topics we should cover, speakers we might want to invite, or for you to volunteer and say you'd like to present about some work you've done. Please just always let us know if you want to do that. All the recordings and materials are posted on a Google site that's maintained by our colleagues at the Alliance. So you can check there not just to find today's materials tomorrow, but also to look at the history of the topics we've covered, and you may find others that are interesting to you where you'd want to check out the slides or listen to the recording. So that's a rich archive, and I encourage you to check it out. Didn't click. There we go. Our upcoming webinars in December, we're going to return to this technical assistance clinic approach, which we did in our September meeting, and we didn't get through all the questions that were submitted, so we're going to do another round of that. Basically, we'll have myself and folks from the Alliance, possibly some of my other colleagues from CSSP, who will be ready to answer questions. I will get some of the right people to be on the phone based on what the questions are that are submitted, and we'll just run through questions. You can ask a question when you register. You can ask a question on the call itself or email me in advance, and then you can jump in with your responses to other people's questions as well. So we did this once before, as I said. It seemed to be successful, but it took longer than I thought, so we didn't get through all the questions, and I'm excited to return to that topic and get through more of it and help you make connections so you can learn from each other. And there's that reminder again to let me know if you have a topic you'd like to suggest for a future webinar. I'm scheduling out the first 6 months of 2017 at this point. I do think we're going to have a quick announcement from Martha Reeder from the Alliance. We don't have a slide for that, but if you want to jump in, Martha, and share about your upcoming event.
Thanks, Kaylin. Hi, everyone, and glad to be here this afternoon, and I see a lot of familiar names on the list of attendees, so glad to see those always, and some new names as well. So the Alliance is sponsoring a training of trainers in Princeton, New Jersey in the second week of December 12th through 14th. That's a Monday through a Wednesday. And we do have a couple of training spots left in that group. It's going to be a really lively group, and if you're interested in being part of that. If you're a trainer or you have some trainers in your state that you have been thinking about getting involved in being certified as an Alliance certified trainer for our protective factor training, then if you will contact me and I can give you some more information about that. We would probably want to do that pretty quickly so that we can get, we have to get all our materials ready for that, but December 12th through 14th, and you can contact me, Martha.Reeder, R-E-E-D-E-R, at ctfalliance.org, and I'll put that into the chat box so everybody can see it. That's all I have to share today. I'm looking forward to the rest of the presentation today.
Thanks, Martha. And I did actually put your email in the chat box there. I think Trish did too, so people should be able to find that. Okay, and then I'm going to share just a couple updates from CSSP. Always want to keep you guys all up to date on our Strengthening Families developments. I'm excited that we have a new fact sheet out. We did this series starting a few years ago called Making the Link, where we make connections between Strengthening Families and other either evidence-based programs or bodies of work that are related to supporting families, helping people to see how they're connected. And a lot of it is about understanding that they are connected and that you don't have to do one or the other, but you can be doing multiple initiatives, and a lot of different work comes together to build protective factors for families. So we recently worked with the National Fatherhood Initiative. They had put out a white paper, which some of you may have seen on their website, about how their materials and resources build and their programs build protective factors for fathers. So we worked with them to put together just this two-pager, or you can print it out front and back, one-pager, that talks about why it's critical to reach out to fathers in particular. We know that in a lot of early childhood programs, when we say parent involvement, what we most often get is mothers, and what we most often cater to is mothers. And if we're not really intentional about reaching out to fathers, they may not feel welcome, and they are less likely to be served. And then on the back page of the fact sheet, we go through each of the protective factors and how materials from National Fatherhood Initiative support that protective factor for fathers. So I hope that if you're working with fathers, you will check this out. If you're not working with fathers, I also hope you'll check it out. If you're finding that not a lot of fathers are taking advantage of the services you offer, I'd really encourage you to read this fact sheet and see if there's any ideas in it that you could apply, and of course to reach out to National Fatherhood Initiative if some of the resources mentioned seem like they would be useful for you. And then the last thing I want to share is a request from the state of Georgia, from Strengthening Families Georgia. They recently, actually I think just yesterday, reached out to ask me whether I knew of other states or communities that they could talk to who are using a protective factors approach with families of children in the juvenile justice system. And I am not aware of anyone doing that, but knowing how this network works, I thought there might be people who are doing that, and I just haven't heard about it. So we thought we would put out the call here. If you're using a protective factors or protective promotive factors approach like Youth Thrive, or just using Strengthening Families through your juvenile justice system, please let us know. You could even type into the comments right now. Jeanette, I know, is on the line. Jeanette, if you want to say anything else, I could unmute you if you type a little note. But otherwise, folks, just reach out to her, and maybe she has her hand up. Let's see. Okay, I'm getting lost in my, there we go. Okay, I'm going to unmute you, Jeanette. It looks like you are self-muted, so if you unmute yourself now, you should be able to speak.
Okay, there we go. Can you hear me?
Yes.
Okay, great. Well, Kaylin did a great job of explaining what we were looking to do around family engagement with families that have children in the juvenile justice system, specifically working with families whose children are being released from detention. The age group that our DJJ is working with is 13 plus but they do also work with families of younger children. So if anyone has any experience in this area, please let me know so that we can chat with you. I'll bring in our family engagement coordinator for DJJ in Georgia, and she's very interested in finding out how she can embed the protective factors in her work with families. Thanks again, everybody.
Thanks, Jeanette. All right, so let us know if you've got any connections, experience, or thought on that. And with that, we're going to move into our topic for the day. We're hearing from Blythe Butler and, oh, I'm hearing an echo now, and Samantha Berger, who both work on the First 2,000 Days initiative in Calgary. And I am hearing an echo, but I will stop talking soon and it may not be an issue. So Blythe and Sammy reached out to me probably about a year ago when they were getting started on this work and found protective factors, the protective factors framework, and were wondering about the possibilities for using it in their collective impact approach. And I've been very excited to have good conversations with them about what they're doing, and very excited now for them to report on what they've done so far in a year. And I'll just say I'm hoping that a lot of us who are here will learn ideas that we can apply in our own work, and some people may even have similar experiences, and if so, I hope you will type in the comment box or raise your hand to share your thoughts once they've presented their materials. So Blythe and Sammy, I'll hand it over to you.
Great, thanks Kaylin very much. Can everyone hear okay? Or Kaylin, maybe you can let us know if the echo is still there or if it's not there.
I think it's better.
Okay, good. So I think everyone can see Sammy and I now. Hi. Thanks Kaylin for letting us have this opportunity to share what we've been doing in the last little while. I'm Blythe Butler, and I'm currently working with the First 2,000 Days Network as the Network Weaver, which is the official title, which no one knows what it means, which is actually quite useful sometimes. And then Sammy, I'll pass it on to you.
Hi everyone, I'm Sammy Berger, and I support the network's evaluation and learning strategy.
Great. So, so you'll see here our mandate, essentially, which was, you know, it's a long story. It was inherited. It didn't come out of nowhere. There was a lot of people working in the field of early childhood development in Calgary and area before we ever showed up. But there was this idea that there was a need for a collective response, and the collective impact framework had recently come out, and so there was a lot of energy around that. So we are essentially a network of organizations, individuals, community members who come together around this vision of supporting the development of children, certainly in the early years 0 to 5. So the name The First 2,000 Days Network came from this reference to 2,000 days from conception into entering kindergarten. And what can we do as a collective, as a community of agencies and people working in that space to improve outcomes for our kids? So that's our definition. One thing that's really important about who we are is that we are explicitly not a funder, nor do we have programs and services. So that begs the question, well, what do we do? And that's sort of what we'll explain through the rest of the slides. So most of the people on the call are probably very familiar with the next few slides just on early childhood development, but it helps to frame where we're coming from in that space. You know, the research coming out of Harvard and the Scientific Council stating that, you know, over now 85% of the brain's wiring occurs in those first 2,000 days, and there's lifelong implications for that development, and certainly trauma-informed care and literacy levels and vocabulary levels and all of that stuff is embedded in that research, but that was sort of one of the sort of lightning rods for us to come together around this new information on brain development. And then also the return on investment on investing in early childhood, which again I know most people on the call know, But on the next slide, you'll see sort of the reference to Heckman's research around $1 invested in early childhood is the equivalent of investing 8 or later on in life. And I think 8 is quite a low estimate. So those were the two really high-level reasons for paying attention to early childhood on one hand, but then also trying to act a little differently in the system. And so Sammy will talk a little bit about that on the next slide.
Yeah, so as Blythe mentioned, we aren't a funder and we don't have programs, and if you look at our purpose statement, you'll see that our purpose is really to focus on how people in the sector and organizations in the sector are working together. And you'll see on the next slide with our theory of change that that is also echoed there. Sorry, next slide, Kaylin. Thank you. That the network is working to figure out what it means to link, align, and leverage what's working in the early childhood sector in Calgary in a more productive way. You'll also see in the theory of change that we're working through actors at the system, agency, and community level and directly with them to hopefully have impact on children and families further down the line. So we also don't work directly with families and children. And this theory of change, I mean, part of what we're talking about today is it all has to be tested out and fleshed out. So what does linking, aligning, and leveraging really mean? And how would we know that changes at the organization or agency level would have a positive impact on children and families? So all of that, all of what we do is a process of testing that and sort of becoming more clear about what that looks like. Blythe?
And so on that, this slide has come to us from the folks at the University of Denver, Colorado, who do a lot of work on network analysis. And because we were, on one hand, calling ourselves a collective impact initiative, so asking ourselves lots of questions around, well, what is that and how do you do that, which we'll go into a little bit. But we also had this term network in our name, and we thought we better figure out what it means to be a quality network and how would you know. So we hooked up with the folks at in Denver. They do some great work there, and they have a tool that helped us evaluate our network strength, essentially, our quality as a network. But some of the research they do talks about process outcomes or systems level outcomes. And this is an amazing slide, and it actually helped us solidify our theory of change, which was to say, you know, on the right-hand side of the slide, children and family outcomes, that's what we're all here for. We want to improve the lives of children and families. And we do that primarily through our relationships with them through the programs and services we deliver. But if you sort of back out, so you have a connection with the family and the child with a primary caregiver. That primary caregiver exists within a team. That team has a manager. That manager has a manager. That manager sometimes has a manager. That organization exists within its own mandate and vision, within its own board, within its own funding sort of ecology. All of those relationships along the way actually impact how that primary caregiver interacts with those families and children. And so to take a look at how the quality of those relationships or the quality of those processes all along that line are functioning, and those process outcomes listed in the middle of this slide speak to that. So there's ways of measuring things like value and trust and whether the process is authentic and how those goals along the line actually line up. And how does that actually work within a community context? So this is an important slide for us because it shows that if you spend time actually focused on those process outcomes within the system and amongst the players in the system, you have a better chance of positively impacting child and family outcomes. And some of the research done by a gentleman named Darren Hicks out of the University of Denver as well he has a model and has done research on, through the Nurse Family Partnership and the Early Childhood Coalitions in Colorado to essentially prove the research behind this idea, this slide. So we wanted to share it because it really had an impact on our ability to gain a little confidence in the approach we were taking, because we are so focused on those process level outcomes. And on the next slide, you'll see I've been referencing, the collective impact approach and the network approach. And with the number of people on the call, it was too hard for us to figure out who knew anything about either of those approaches. And so the details, not hugely important, other than the way that we've identified how they work together for us, is that the collective impact approach really helps us understand what we should be doing. So there's 5 tenets in collective impact, which we'll go through. Those 5 tenets guide the what we do. And the network approach informs the how. And both of those things inform the structure of our specific entity. So in terms of network theory, on the next slide, you'll see an outline between traditional organizational mindsets and a network mindset. These are very general, and there's many different types of networks, so these are a little bit fluid. But that bottom one, where effectiveness is essentially linked to conventionally understood things that are intangible, or conventional association with things that are intangible, like trust and value and relationships, which is the stuff that the University of Denver helped us figure out. And then on the next slide, collective impact is essentially this framework that is designed to guide, it's an approach to help coalesce all of our individual impacts that we're having as a result of the programs and services and interventions we are working with, to a more coordinated approach, to an approach that's actually aligned toward a broader social impact, so a social change for the population you want to help. Sammy, do you want to do the next one?
Sure. And so, I mean, the collective impact framework is powerful in a lot of ways, and as Blythe said, when we started with the network, there was a lot of momentum around it. But part of our work in relation to the collective impact framework has been trying to figure out how each of the 5 conditions actually function and how they relate to our context. And what we're going to be sharing with you today is our exploration, partly into how shared measure functions in the context of the network and what we're trying to achieve.
And I think something on this one is a lot of people who are working with the collective impact framework really get stuck around the shared measurement piece, because I think there's a lot of assumptions around, well, that must mean we're all measuring the same thing. We all have the same measure. And because of the network's lack of influence, lack of power, because we're not a funder, there was no way we were going to be able to drive the entire sector around a single measure. That just wasn't, it was a bit of a fantasy. So we had to figure out really well, what does shared measurement mean given our particular place in the system, the capacity we have to do anything, and that's sort of where we started and what led us to strengthening families, actually. So on the next slide, you'll see a picture of our structure, speaking of, the collective impact being the what and the network piece being the how. This really just shows that we have a backbone, which is, again, collective impact language for the kind of functions that need to be provided for really any entity to exist. And then we have what we call change nodes, which are people and projects and initiatives and agencies who are linked into the center, but then back out again. So this image is our attempt to try and illustrate how the collective impact framework guides our functions, but that our structure is really, truly an organic and very open network. And so now we'll jump into how we actually have been using strengthening families within this collective impact model around the idea of shared measurement.
Yeah, so before we get into the specifics of sort of what we did to start testing our understanding of shared measure and to start using the Strengthening Families framework in a really direct way, we thought we would talk a little bit about how we understand shared measure to function. And that relates very closely to the network strategies. So broadly, the network is trying to support behavior change, collective action, systems change through a process of adaptive learning. And for us, shared measure actually plays a very important role for each of those strategies. And as Blythe said, this may be a little different from how shared measurement is traditionally understood in the collective impact literature. So we could actually look at how our approach to shared measure matches up to the network strategies on the next slide. So one of the functions of shared measure for us is that our measurement and learning and evaluation practices drive our strategy, not the other way around. And that's really important because it supports our strategy for adaptive learning. And basically all that adaptive learning means is the continuous attempt to match our capacities to the context that's always changing and our capacities that are always changing around us. And the reason why our measurement has to drive our strategy is because what we're learning about the situation is actually informing how we're acting in the situation. And we have to organize how we're learning about the situation in a way that is narrows down what we're looking at, because there's so much information we could be taking into account in such a complex context. So shared measurement plays a big role in our ability to learn adaptively. Shared measure is also really important in terms of our supporting our approach to quality and our understanding of quality. And as Blythe mentioned, it doesn't mean that everyone is measuring and certainly not doing the same thing. But in having a shared measure that is sort of located outside of us and outside of the mandate of a single organization or the experience of a single individual, it really supports a culture of learning and discussions around quality and what needs to be done and how to move forward in a really different way. So focusing on shared measure and focusing on learning supports a culture of learning that's really important for us to start talking about behavior change and different ways of working together. That's not steeped in sort of how people have done things historically or specific approaches to that an individual organization or agency might have. Do you have something to add, Blythe?
Nope.
So I move. Okay. Don't move. Another role that shared measure plays for us as a backbone is it's a way for us to tell a story about the early childhood landscape in Calgary and area using consistent but also meaningful language. So as a backbone that is hoping to support collective action and also start to think about what systems change may look like, having a shared measure that actually connects what can happen at an organizational level with population level outcomes for children and families, which is what we're hoping to eventually impact, means that we could pull out the meaningful pieces of what's happening or what needs to happen in the broad and complex landscape of ECD in Calgary and area. So it gives us a way to structure the types of information we're pulling out and what we're sharing with other people in the vast system that we're trying to work in. And lastly, and possibly most relevant to the example we're going to share later, is that our shared measure functions to drive our engagement and capacity building efforts. So as a network, we say, we're engaging different stakeholders in the network and we are trying to build capacity in the network, but we came to a point where we had to figure out how to figure out what to build capacity around and what to engage around. And our way of deciding that, again, couldn't be built on the mandate of we didn't want to just pick something. We had to pick something that was research-based and would support the outcomes that we were looking for and could actually organize how we were focusing capacity building in the direction that we were trying to support behavior change more generally. We say we want to change behavior, but in what direction, and how would we know if that behavior change is actually helping children and families in the long run? And our shared measure had to play that role. And so in terms of thinking about outcomes for children and families, strengthening families is what we're testing in terms of whether it plays all of these roles. So why strengthening families out of all of the frameworks and ways of thinking about this that exist? The first is that it's supported by a lot of robust research, and this was so important to us because, again, we want to support behavior change and capacity building in a way that would actually have positive outcomes for children and families down the line. So we needed a framework that showed that working in this direction would have those outcomes. We also needed something supported in research because, as I said, we didn't want to build our the direction of our learning based on experience or sort of a more narrow mandate. So the quality of the research behind the framework was really important to us. Also thinking about the operational requirements involved in capacity building, the fact that tools and support already existed for the framework was really important. As a network, we do not have the capacity to research and there's no reason to research our own framework and build out all these tools and build out all this support. So we wanted to choose one that already existed, but the fact that strengthening families already had a lot of communication that, if we were building capacity in one organization that they could take and share with others was really beneficial to us. It also had to be broad enough and specific enough, and by that I mean it had to be broad enough to include the diversity of the stakeholders involved in the network. There are some indicators that we know are really predictive and important in terms of positive outcomes for children. So literacy and the amount of vocabulary a child has when they reach a certain age is predictive of outcomes, but that's really narrow in terms of including all the diverse people involved in the network. So we needed something broad, but we also needed something specific enough that it could actually guide behavior change in a meaningful way and could provide the rich and quality content that could tell people what, for example, parental resilience actually means in detail in a way that could actually improve their practice. We also want to make sure it was in alignment with other frameworks in use in our context. Unfortunately, as a province, Alberta doesn't have an early childhood development strategy that we could build off or specifically feed into. So there's a lot of different frameworks in our context that are being used by different organizations and different funding agencies. So we wanted to make sure that the framework that we chose complemented those and aligned with those, and we looked into even using some of those, but we needed something that fit the other needs listed here. And luckily, the Strengthening Families framework aligned with a lot of the quality frameworks that are already being used in the context, but also fit our other needs. And last, the Strengthening Families framework was in use in the community already. One of our backbone members, Iris Sparrell, told us about it to begin with, and it was so great that it was already tested in a Calgary context. I think it provided a lot of legitimacy to her peers that were willing to test the framework along with her, and she could share a lot of her experience of the challenges of trying to implement the framework and some of the benefits of it that we could flag and plan for moving forward. So it's been great to have someone who has experience with it on our team.
And also, just quickly on that, so we had someone who was working at a very local, almost neighborhood level with being informed by the Strengthening Families approach within our team, which was exciting because we had sort of this ground level understanding of some barriers and opportunities they'd faced in that context. And although Alberta doesn't have a very, almost like a guiding philosophy around children, not just even just 0 to 5, but 0 to 8, that kind of idea, we did have the Ministry of Human Services who uses Strengthening Families in their funding approach to agencies that serve children and families sort of more at risk. So it was a more targeted use of the framework, whereas we were taking it as, like Sammy said, that third bullet point as much broadly. And a little sort of anecdote, when we said we thought we might want to test the Strengthening Families framework with our team, there was one member of the team who had a visceral reaction because her whole work in her life around early childhood had been about helping kids that weren't necessarily at high risk and didn't need intervention. It was like her approach to early childhood was really founded in this philosophy of helping all children and all families. And so because of some of the history around the use of the term Strengthening Families within our context, we actually came up around barriers around it that we hadn't anticipated, but that were so helpful because we could understand even some of the baggage that the Strengthening Families framework carried within our community, and we then had the opportunity to address that and think that through and we've tried to be very careful about that, because there are, I think, multiple avenues to use the framework in, and it doesn't, it wasn't immediately obvious to everyone how they could see themselves in it. So that was part of our work, was to help people see themselves in it without being sort of this top-down application of it in programs and services or in agencies. So over to you, Sammy.
Sure. So what did we do? We have all of these ideas about how shared measure functions and why Strengthening Families is going to be a great shared measure. And the parental resilience pilot was our first attempt at testing and learning a bit about some of our own ideas. And the parental resilience pilot was focused mostly on how the shared measure can support behavior change. And we chose parental resilience on Iris, our backbone team member who had experience with the framework. Her advice that a shift in a relationship and shift in thought about how we need to interact with parents and value parents and caregivers was foundational to making a significant change in the other 4 factors as well. So we chose to focus on parental resilience for this pilot. And in terms of the structure of the pilot, it basically lasted about 3.5 months over the spring of this past year. And it was 6 sessions. One of the big decisions that we made was that we would have coaches provided through the backbone for each of the 7 organizations that participated, because we knew that people coming to 6 sessions that lasted a couple hours each wouldn't be able to support the type of change and thinking that was required in between the meetings. So the coaches were really important for those in between conversations and reflection, and also for the backbone to have a better understanding of what was actually happening in at the organizational level and at the participant level.
Oh, Sammy, you cut out there. Well, maybe I'll keep talking because Sammy froze.
Yeah, frozen.
Okay, Sammy froze. I'll keep talking. So as a result of this structure, essentially we embedded not only knowledge translation or knowledge mobilization around what strengthening families is. And again, Sammy, back to the point around the tools and resources provided by CSSP and the support from Caitlin and the team were huge, like hugely instrumental, because we were relying on such good work that had already been done to actually then take those materials, make them fit for our context, and share them with this group. So there was a level of information sharing about what exactly parental resilience is, what the strengthening families framework is, and then that was supported by one-on-one coaching and then group basically learning opportunities amongst the 7 organizations, but also amongst the coaches who were going down this process in parallel. So we were learning as an organization as much about strengthening families as the people we were coaching, which is an interesting dynamic. So there was 2 parallel learning streams going on at once. And that enabled us to not only track our own learning and what we needed to respond to from what was coming up in the actual workshops, but then offered an opportunity for us to support that learning outside the workshops, which I think increased the ability for people to actually use what they were learning and then bring it back and forth and sort of go through that peer-guided process. So Sammy's back.
You guys make a great team, I just have to say.
Thanks. So I think that's it probably for that slide, I think. Yeah. Okay.
All you know.
This is me. This is me. Sorry, this is me. So on we go. So this is just a link back to how the Strengthening Families Framework in our use of it helped meet our strategy around capacity building. And again, it wasn't just that we were sort of playing this role as teachers of strengthening families to these group of agencies, but we were actually building our capacity to understand what we needed to learn to be able to be helpful to them. And there's a spectrum there because we wanted to make sure we actually met people where they were at, where they were starting from, and then move them from there. And that's that first box you'll see on our capacity building model, which is how do you actually develop a deep and comprehensive enough understanding of the situation or the organization you're working with to know what's going to be helpful for them in relation, in this case, to parental resilience. So we had to really help the organizations not only assess themselves, but we had to also be able to help them through that process. And if someone's, big idea was to create a welcome poster for parents when they come into the facility as part of their improved practice around parental resilience, that's okay because they didn't have that the day before. And they were thinking about, as that poster represented more than just a poster. It represented them thinking about the role the parents play in the children's lives that they serve and the relationship that they should have with those parents. Other organizations who were, school boards, for instance, already had different organizational capacities going on in their own context, so their opportunity for change or for improvement around parental resilience looked much different, which is actually why the coaching model works so well, because you had an individual relationship being built that just deepened and deepened our opportunity to help people essentially along this journey of learning about parental resilience and about change, essentially, capacity building. So on the next slide, you'll see those impacts. So again, back to sort of our internal goals, it did support our culture of learning. It did actually focus sharing. So one of the things the network struggled with really early on was, let's just tell us what you're doing. Let's all share with each other what we're doing, and then we'll have a better idea of what's going on in the system, and then magically change will happen and we'll all be doing things better as a result of just at least knowing what everyone else is up to. What Strengthening Families did for us was we were sharing specifically around our ability to meet a quality definition of parental resilience. That's much different than general sharing. And that had a huge impact on our ability to play, I think, a useful role in this process, because we now had this external definition of what good looks like, and we could all drive our sharing sort of underneath that understanding. So that was huge. And we also knew, in terms of behavior change, the tools in strengthening families were really useful for us to figure out what change actually looked like and how to help people move, or at least map out what continuous improvement might look like. And then, again, the sort of focus of this presentation is, if we are truly a collective impact initiative, which frankly is a choice, I'll just make a comment here. I don't think that using the collective impact framework is necessary or sufficient to actually have a collective impact. I think a lot of organizations, funders, people like CSSP have collective impact without calling themselves a collective impact initiative, but we do call ourselves a collective impact initiative. So this actually really helped us match the role we wanted to play against the language we were using to describe ourselves, and do it in a way where we could have some confidence that we weren't inventing something, and that there was others in the world who understood this process and who had way more experience than us that we could draw on. And that was actually part of our motivation for connecting with Kaylin, and the opportunity today is not to share this, hopefully people learned something, but also because we are sort of reaching out to say, we'd love to learn more about how other people may have used the framework in a similar way, and can we talk to you about that, and even share in more detail how we're approaching it or what our ideas are for going forward, because sometimes it feels a little lonely way up here in Canada. And anyway, so we share that, just if anyone's interested in continuing this conversation in more depth, we'd love that. Yeah, and we just had an amazing, before we sort of close off, I think we really had an amazing team at the network who, to their credit, said, sure, we'll jump in and figure out how to teach strengthening families to people at the same time that they're learning it, and we'll try and coach them on this thing called parental resilience that we're also learning at the same time. Like, that's hard to ask people to do, and we had a great team who just sort of jumped in, and all the resources that have been developed by CSSP, and certainly out of the experience of all the people on the webinar, really were amazing in helping us be able to do that. So kudos goes out to all of you for pulling it all together the way you have. And steps for moving forward. We hope to run another pilot with another group of agencies, and also to continue with the original group of agencies who entered through parental resilience, to expose them to the connections between parental resilience and the rest of the protective factors, because we do know in order for the framework to have integrity, you have to look at all of them, and we just didn't have the capacity to do them all at once. We will repeat and always use parental resilience as our entry point, for reasons Sammy stated earlier, into the broader framework. And the pilot is really an opportunity for us to also develop our own tool for agencies to use around the idea of parental resilience in a cafe conversation style. So I know there's some resources already on CSSP around using parent cafes and the cafe model to engage with parents. We are lucky enough to have two of the very, very best community development and cafe design people probably on the planet living in Calgary, and so we'd love to engage them to help us develop a further resource that can be shared in our community, but certainly more broadly. And so our fingers are crossed that we'll have the ability to build that tool out and hopefully share it with everyone. We also want to, so next slide, we want to know the extent to which people can actually embed this framework into their practice, and the difference between them understanding the full framework versus just parental resilience. Does that change their ability to work with it? What are all the constraints that are in place for people, and can the network, as the first 2,000 days network, actually do anything about most of those? And share how this has helped us build a really collaborative and a high quality collaborative process. We have a lot of improving to do on our next pilot, but the the value of having a culture of learning be at the core of an organization is that you have the chance to actually change it every time you do it based on what you learned the last time. So there is sort of there's no baseline. We reinvent the baseline every time in a way. And we've learned a lot about collective impact and the function of a shared measure. And Strengthening Families has been an amazing framework to help us test that out. And I think that's it. Sammy, any final thoughts?
No, I just would love if there's any questions. I mean,
Yeah.
I know there's only 10 minutes left. That'd be great.
We do have one question typed in already, which is from Debbie Peterson in Washington State, not too far from you guys. How many people attended the workshops, and were they in agency and organization teams or operating as individuals?
Great question. So we had 7 organizations with 2 people from each organization. And we tried to sort of get management, if you want to use that word, level, and then frontline level, which wasn't always the case, but that was kind of the idea. And I think if we were to offer the parental resilience pilot again, we'd offer it again to those same agencies with different people, because I think part of it is just increasing the numbers. And the network is constrained by our own capacity to actually provide coaching to the organizations in between sessions. So I don't think we'd ever go more than 8 agencies at a time. It also is the right number for group work and group learning and group conversations. Yeah, so that's what we did. Not by design, sort of by accident, but I think we'd stick to that number.
And can you say more about what kind of organizations were represented?
Sure. So we had a few child care providers. We had the Calgary Board of Education, who has preschools. We had agencies who serve families and children. I think that pretty much covers it.
We had one school age.
Right, that's right. We had one agency who served children outside of our demographic, so school-age children, but they understood they have families that they serve. So like wildly, they probably want to know about parental resilience. So yeah, so they were involved, and yeah, I think that's it. We were really happy that we had, institutions as large as someone from the education system in the same room as small, relatively small child care providers.
Great, thank you. Someone else just typed in requesting that I go back to the slide with your contact information on it because they were noting it down, so I went back to that. And then someone asked about whether you had cafe conversations woven throughout the pilot or if that's just something you're planning for the future.
We're planning that for the future, although 2 of our coaches were the designers of the cafe conversations we've used in other contexts. So we actually have a cafe conversation that we have designed around the core story of brain development and the research out of Harvard. And so luckily, they were 2 of the coaches in the process, so now they understand very deeply what it is we're trying to do, and the opportunity now is to embed their expertise into our pilot process more deliberately, and certainly around the content that we provided.
Great. And then we had 2 people type in pretty similar questions at the same time, which are both, I'll read the one that Brianne Schubert wrote. She wrote, can you share some examples of the changes that organizations implemented based on the parental resilience pilot?
Sammy?
Sure. Yeah, so So I know that some of the organizations decided to create like a parent advisory board. Another was trying to, at the Calgary Board of Education, was trying to sort of replicate the process with their own staff throughout the Calgary Board of Education at the preschool level. Part of our work going forward is sort of following up with people about the changes. Like a lot of them left saying they wanted to make certain changes, but we don't know if they actually followed through and did. Some of them, like Blythe said, were at a totally different starting place and was like putting out material for parents. So like a whole range of things, going from like planning to hand out brochures to trying to embed a strengthening families approach in the entire Calgary Board of Education. Like, and the time that it would take to do that in the Calgary Board of Education, it's sort of like what capacity, what support could the network provide them moving forward in trying to do that, things like that. So we're still trying to figure out sort of like what that looks like and what people need. So yeah.
And I would say that's
wide-ranging.
Yeah, and that's certainly one of our learning is the limitation of the amount of time we had to actually deliver the pilot. So you don't actually see the implementation or the ideas that are generated as a result of, for instance, using the self-assessment tool through the Mosaic program as a way to guide conversations around what could or should happen as an improvement on parental resilience as a factor. There's a ton more than enough there for everyone to work on. It's a matter of, do we play the role in helping them implement that, or is that then in their court, or like where does that line end? And we would hope that the line would never end. We'd love to help with the implementation, but it just wasn't part of this particular pilot. That's certainly an opportunity. And I think one of the biggest learnings, well, it wasn't one of the biggest learnings, but was an interesting conversation, was this a child care, one of the women who was in the group who worked with many child care providers. We sort of said, it's interesting, like we think of ourselves as child care, but what if we're actually parent care facilities? And it was like these little light bulb moments where people would just reframe their function in their role with children as a result of what they've learned about parental resilience, which to us is huge because that's the first change that needs to happen in order to then implement anything.
Yeah.
So that was a huge win.
It was also interesting to see like how people came into the pilot and how that impacted what they decided to do after, because like one organization that's quite large came in like looking for a framework to frame their strategic direction going forward. And like they were happy that we could provide them an introduction to strengthening families and strengthening families beyond parental, like the entire framework, like that's going in their strategic plan and that's how they're moving forward. So like that's what they're doing, but it's sort of hard to know whether they would have done that with or without the pilot. Like I think the pilot helped, but that's the mindset they came in with it, and other people were kind of like, oh, well, we like the people involved, let's give it a shot, and came in with that mindset and had light bulb moments, some of them, and some of them were like, that was a great professional development opportunity, but that's sort of, aren't bringing it forward at an organizational level. So it's also thinking about what does readiness in terms of participation mean? How do we know, what does success look like for us? What sorts of changes are we hoping for and expecting? Those are all hard conversations we have to have with our team.
Mm-hmm. Thank you. That's really interesting. And I'm about to post a link that Debbie Peterson from Washington State shared. It's called Advancing the Measurement of Collective Community Capacity to Address Adverse Childhood Experiences and Resilience. So definitely a related topic that I think you guys, as well as those listening in, may be interested in learning more about that. And that is from Washington State. So thanks for that link, Debbie. And she actually just wrote in a longer description of it. It describes the development, design, implementation, and results of the APPI evaluation ACEs and Resilience Collective Community Capacity Survey. So I'm not going to read off the rest of it because we are actually coming up to the end of our time together. I think this has been lovely. So good to hear about the work you're doing and the thought that you've put into it. And I think people are going to take a lot away from this conversation. So thank you, Blythe and Sammy. It was really great to hear from you, and I know you're going to keep doing great work, and we'll keep checking in on how that's going. And I just want to thank everyone for joining us today. A special thanks to everyone who typed in questions and shared resources. That's always helpful. And I look forward to talking with you all again in December. And remember to register for the webinar and send in your questions so we can have a rich discussion about the issues you're facing in your Strengthening Families implementation. Thanks as always, everyone, and have a great afternoon.
Thanks, Kaylin.
Thanks, everyone.